Hi, welcome. All right, today we're going to be talking about a question from Janice. How did you go about switching from the pediatric teams to adult doctors? Man, oh man, this, Janice, is a question for all of us. This was one of the hardest things I've ever had to done as well. Of course, you're probably going to hear that a lot from me. But transitioning, when you have a child with hydrocephalus, you create such a bond with your neurosurgeon. You actually almost love your neurosurgeon because they saved your child's life. And as a mom, you know, you're loaning your child to someone, you're handing them over to someone to take care of, and you can't do anything else. You have to just stand there and wait till they come back out of surgery. So it's a struggle. So you've spent years developing this bond with your pediatric neurosurgeon. He knows about your family. He cares about the whole child's well-being. You sit and chat during your appointments. It's never a 5-minute hi and goodbye. When you're switching to an adult neurosurgeon is totally different from pediatric neurosurgeons. Their whole focus is different. Adult neurosurgeons focus on fixing the problem and not seeing you again unless you're having problems again. And that's not what we were raised with when we have dealt with pediatric neurosurgeries. Neurosurgeons, they treated the entire family as a unit because they know that hydrocephalus affects the entire family. So it's essential that you prepare to the best of your ability. And the Hydrocephalus Association and I have created many things, which we will have links to available at the end of this blog that you can go to learn about suggestions on transitioning. The Hydrocephalus Association has produced an excellent transition guide that will be very, very helpful for you in this transition period. We both suggest that you start transitioning about the age of 13, 14. Start letting your child do all the talking. If you haven't before this time, you should have really started letting your child do a lot of the talking before this time at your doctor visits, because start teaching your child to take charge from early on. It doesn't have to be 14. You can start them at 8 or 9. My children always talk to their neurosurgeon because I wasn't having the headache, they were. So how could I tell them, the doctor, what their headache was like? So it's very important to empower your child as soon as you can to start taking charge of their condition. It's not an illness, it is a condition. They will have it all their life. So they need to learn how to take care of it. So especially at age 14, you get our transition guide, you start doing the suggested things. Usually most pediatric hospitals will take care of you till you're up to the age 21. You'll have to check with your various pediatricians, but your best person to start with is your pediatric neurosurgeon. Number one, ask him or her, where do you think I should go for my adulthood care? Your doctor is your best source of information at this point. They will have some good suggestions for you. Many of them have already put in place transition. If they're associated in a large city with a medical center attached to them with a children's hospital and next door a big university-sponsored hospital, then that's usually not an issue. Your pediatric neurosurgeon can usually continue to care for you as you age at the adult hospital, because all he has to do is either walk across the street or walk across a covered bridge. They're all attached. It's different if you're in a smaller community, not with university hospitals, with separated children's and adult facilities, so that's going to take more thought. I would suggest you interview a number of adult neurosurgeons. You want to get a feel for, are you compatible with their personality? Just a little bit, because you're going to want to have somebody that answers your questions and talks to you. You don't want somebody that's just going to be hi and goodbye. You do want to check on their qualifications. You want to try to make sure that they're board certified if possible, unless they're at a learning institution where they are highly covered by competent board certified neurosurgeons. And again, this is questions you will ask your doctor for all their suggestions, okay, because they're the best ones to help you on the peer related issues like that. For yourself, you need to prepare a list. You need a copy of your last surgery. operation report, which will list the type of shunt that your doctor has placed in you. You will ask for a copy of the history and physical. You will also, because the history and physical detail the signs and symptoms that you're having that are leading to the surgery. You will also have to make sure that you take with you as many records as you can from your primary facility, your primary care practitioner, and the appropriate CDs of your medical, your scans, your CT scans. The most important ones being what do your ventricles look like prior to surgery, and how do they look after the surgery. Okay, those are two most important scans to have because they tell important questions. Do your ventricles expand when your shunt is not working, and do your ventricles go ahead and get smaller? You know, if you have split ventricle syndrome, that's a whole nother issue, but ask your doctor to help you with what you need to take to a new doctor for that. Our transition guide and my presentation that I gave at the 2012 Hydrocephalus conference documents all these items. I'm not going to go through them all because the links will be able to specify this, but it's very important to take with you to meet these new doctors everything you're going to need to make the care transfer as easy on all of you as possible. One thing I do want to mention that's extremely important though is you have to find a doctor before you leave your pediatric neurosurgeon's care. Don't wait for an emergency. If you show up in an emergency room and you are not covered by a physician, a neurosurgeon under that emergency room staff or policy or whatever, nobody's going to know your history there. You're going to be coming in from nowhere. They're not going to know what type of shunt you have. They're not going to know, is this a shunt malfunction? Is this normal for you? You're going to have, you're making it hard not only for you, but you're making it hard for those physicians. They can't look in your eyes and know exactly what's going on. So the best thing you can do to take care of yourself is to meet and get to know a doctor and create a beginning bond with your neurosurgeon before you leave your pediatric surgeon's care, so that you are covered by a doctor who somewhat knows your history. Because the most important thing is not showing up in an ER where nobody knows your history and nobody knows anything about your shunt. It's a very dangerous place to be in. You will be cared for, but you're making it very hard on both you and the doctors, so you want to avoid that. Our transition guide gives you many, many things that you will need to look for and cover. And if you have any further questions on transition, you can also contact the association. We can help you and lead you in further directions as to what you need. But this is a really an issue that is very important to you, taking on the care of being the hydrocephalus patient and growing up and taking on your own care. You're going to have to start making decisions for yourself, and parents are going to be empowering you with the knowledge to know, because when you go off to college, when you're traveling, you're going to have to know your symptoms. So when you show up at, if you are traveling and have show up in an emergency room, you can tell the doctor, this is not normal. My eyes do this when my shunt is not working. This happens when my shunt's not working. Know your symptoms for yourself. Know what's not normal for you. The doctor's going to want to know what's not normal. And protect yourself by carrying information in your phone, maybe that lists the type of shunt you have. We have all this technology nowadays. I think it's only going to help us. There's going to be technology and there is already, that's called Follow Me and other areas that Hydrocephalus has links to, the association, where your scans can be available at a moment's notice and go with you and be transferred anywhere. So look into some of that. Things are getting better and better for those with chronic health conditions. But the main message I want to give you is be prepared. Prepare yourself and prepare your child to empower them with what they will need in the future as they transition to adult-centered care, which is very different from pediatric care. If you have any further questions, please feel free to call the Hydrocephalus Association. Thank you.